One of the doctor asked me a question. It's an MCQ. I think I will just write down the MCQ here. Medico is a medico actually is a medico is a second year medico second year doctor came with a complaint of severe chest pain associated with breathlessness like feature, and the medico looked tensed. The doctor examined and sent for investigations, but investigations and reports are completely normal. Including examination. Right now, with what disorder the medico is suffering with? Now, can anyone give it a answer? It's actually, this question was asked previously in Inicet only, not Inicet. I think in Neet PG this was asked. Can anyone? You want me to give some things? OCD. I will give you options. OCD. Munchausen's by proxy. Dissociative. D. Something with hypochondriasis. Now tell me the answer. What is the answer for this? I will explain what is Munchausen's by proxy. Dissociative already I will explained, and hypochondriasis, OCD. Right? Come on, tell me. Anyone? OCD is something which deals with obsession and compulsion regarding a particular thing. Most common obsession is fear of contamination for dirt or germs. Most common compulsion is hand washing. I think this one doesn't matches OCD. Now, Munchausen's by proxy means what? Munchausen's by proxy most commonly you see in mother with a child. Why? The mother wantedly hurt the child. The mother wantedly hurt the child in order to gain the attention of the family. That is, Munchausen's by proxy is done. Something called malingering syndrome. Munchausen's by proxy, right? Malingering syndrome. So, wantedly you create some symptoms in order to get secondary gain. That is called Munchausen's by proxy. So, OCD eliminated, Munchausen's by proxy eliminated. Dissociative disorders also we will explain. Dissociative disorders is not that one. You have something called dissociative dysmorphic disorder, dissociative neurological symptom disorder. So you have purposeful wandering, dissociative fugue. This doesn't have anything related to this. You have several chest pain, he is tense, he is breathlessness, but all the reports and so-called complete examination and investigations, everything came normal, and including the examination was normal. So what disorder? Obviously it is hypochondriasis. Now what is hypochondriasis. Now we will discuss. Can you have another name for hypochondriasis? Of course, it's called illness anxiety disorder. Also called, this is very much important, is also called hypochondriasis. Hypochondriasis. Always remember. It's called illness anxiety disorder, or also called hypochondriasis. But some of the things refer like previously. This term was named as medical student syndrome. Medical student syndrome. Inicet people love these type of topics. Trust me, Inicet examiners, they just love these type of topics. Why? Because these are some of the things that most commonly we see in students, that too in medical stream. Why? Because these medical people, they have excessive fear because they have more knowledge regarding health, so they fear for even small things also. If you get a small rash on a skin, they think like, oh my god, it can be some carcinomatous change, it can be some dermal carcinoma, it can be some tumor, it can be benign, or it is malignant, maybe I should go for an investigation. They will think all this bullshit. So that's why previously it is called as medical student syndrome, and its duration is important, very important. Its duration is more than 6 months. Now, how do the clinical features look like? Now, I already said there is a preoccupation, means the mind already, the patient's mind is already occupied or consists of some unnecessary thoughts, some unnecessary things like preoccupation about having a serious issue with the health, about having a serious issue, serious illness like cancer, TB, and you have, some people even say there is a tumor, or even they say like there is some disorder, etc. Some people even feel like maybe I am suffering with some congenital disorder. I will hear so many doctors, I will listen, I will heard it so many times, so many medical students, they used to say like, sir, maybe I am suffering with this syndrome, maybe I am suffering with that disorder. This all is just illness anxiety disorder, or also called hypochondriasis, right? So it is just nothing but it's a exaggerated fear, nothing much. It's just a exaggerated fear. Why? Because in the previous question that we observe, he's a medico second year, he's thinking like he has symptoms of breathlessness associated with chest pain, but after undergoing for all investigations, everything came normal. So he is suffering with hypochondriasis or illness anxiety disorder, right? Okay.